Hi everyone, I'm Dr. K with Active Care Products, makers of the IntelliRoll's Firm and Flex, the world's first anatomically designed foam rollers. I'm here with mixed martial arts professional Brooksy Bayard, and today I want to talk to you about the significance of tight hip flexors, particularly the psoas muscle, in its implication to low back pain and dysfunction. Okay, so the hip flexors run right here in the front. Okay, and the hip flexors shorten from any kind of weight-bearing activity, such as running, in Brooksy's case, kicking really hard. And for those of you who are seated throughout the day, that muscle is going to shorten. Okay, and the best example I can give you is if you bent your elbow and walked around all day long, your bicep muscle would literally shorten. Okay, and when you went to straighten your elbow out, you wouldn't be able to do it because that muscle's shortened. So for us that sit a lot in our occupations throughout the day, those hip flexors are going to get shortened. And here's what it does to the pelvis. When it shortens, it's going to pull the pelvis forward. That forward tilt of the pelvis from the tight hip flexors is going to compress the joints, shorten the low back muscles, and inhibit the abdominal muscles. So that's why it's really critical to improve low back function that you release the psoas muscles. And then we're also going to show you how to strengthen the low back muscles. Okay, so the edge of the psoas muscle is right in here. Now, the psoas muscle originates in the back, goes behind the abdominal cavity, and attaches on the inside part of the femur bone. So to get to it is really challenging, but with the IntelliRoll, there you go, we got the solution. Because of the hooked edge, it's going to wrap right around there. So a lot of people will use massage balls to get in there, and because of the design of the IntelliRoll, it's very stable. So first thing we're going to do, Brooksy's going to lay down, she's going to go right in this area, and I'm demonstrating this because it's going to be a little bit challenging to see when she's face down. Once she's in that position, she's going to breathe, and then she's simply going to roll up and down right inside of the hip pointer. So if you find that front part of the pelvis, you go just inside of that and line up with the outer edge. All right, Brooksy, let's go ahead and show them that. So you're going to use the left edge against the right psoas. And you guys notice she'll find it, and then she'll lay into it. Okay? First thing she's going to do is she's just going to breathe. Okay? And let's go ahead and straighten this leg out and just kind of let that pelvis settle into it. So really, we're not even rolling right now. We're just really doing acupressure. Okay? So just going to let that settle into that area. And once she starts to feel it release, then she's going to use her toes and do small little movements up and down. It's feeling pretty good?
Oh, yeah.
Okay? So that's all she's going to do is do really, really small movements, and that's really all it takes to release the psoas muscle. Once that's released, it's going to release that forward tilt of the pelvis, and we're going to get better activation of the abdominal muscles, which we're going to show you next. Okay? So Brooksy, let's go ahead and actually let's go into a quadruped position. Lots of ways to do core training. Now in the quadruped position, the reason we're going to do it with the quadruped is we're also going to be able to activate the glutes. So come up on all fours. Okay? And the key thing about neutral spine training is to make sure you keep the spine neutral. Now, I use the term neutral spine training synonymously with core training because the core is really the abdominal and back muscles working together as a team. So we want a little bit of curve in the back because that's how we naturally are, and that's how the back muscles are activated. Now, Brooksy, go ahead and really drop your spine down. Really, so that's not neutral. That's hyperextension. Go ahead and flatten it out. Okay, that's not neutral. Okay, neutral is right in between. So Brooksy's going to drop right into that neutral position, and her entire goal is to keep this area from moving. So she's going to activate her abs by bracing, like somebody's going to punch her in the stomach. She's going to focus on keeping the activation in the abs, and then she's going to start by extending the leg. Now, this is level 2. Level 1, you simply lift your arm out to make it really easy, but in this case, she's going to extend her leg. And notice nothing removed here. So she activated her glutes. She's able to keep her spine nice and stable, and for next level, she's going to take her opposite arm and reach out in front of her. Some people call this bird dog. Okay? Go ahead and rib back down, and we'll see her switch that. Again, the entire premise is to keep the spine nice and neutral. You can see her going into a little bit of extension. A little bit of extension is okay, but we don't want to hyperextend. All right, and let's go ahead and switch. Fantastic. So that's really all it takes to activate the core, increase stability of that area, and release the psoas muscle using the IntelliRoll to improve the function of the low back.